Good evening, everyone. Thank you for joining us for the third in our Pain Matters lecture series. Tonight we'll be hearing Dr. Scott Fishman on pain and wellness. My name is J.R. Springer. I'm a Director of Development with the School of Medicine, and we're so appreciative that you took the time to join us this evening. I'd like to start by just thanking our Center for Advancing Pain Relief Volunteer Advisory Board, who had the vision for this Pain Matters lecture series. This is the third in our series. And we appreciate everyone for coming to the first two in person and for joining us tonight for our virtual lecture. The hope is to continue this lecture series, so we'll be following up with a survey to all of you to get some feedback on what works and what doesn't. But we appreciate you again being here tonight. A couple of housekeeping things. First of all, we are recording this event, which will be posted after the fact on our YouTube channels. And closed captions are available if you'd like to turn those on your own screen. If you have any technical issues, please use the chat feature, and we'll be watching that throughout the evening. If you have questions for our presenters, please put that directly into the question and answer section of Zoom. We'll try our best to get those answered throughout the evening and at the end of our talk as time permits. With that, I'd like to welcome the chief of the Division of Pain Medicine to introduce our speaker, Dr. David Copenhaver.
Thanks, JR. It's a pleasure to be here and really get a chance to introduce Dr. Scott Fishman. You know, in reflecting on what it takes to become an international authority, and that's what Scott is in every respect when it comes to medicine. Dr. Fishman has board certifications and training in internal medicine, psychiatry, anesthesiology, and pain medicine. Palliative care, and really understanding end of life. When you take all of that understanding and you wrap all of that in, that's a wealth of experience. He was the founding chief of our pain medicine division at UC Davis, and prior to that was the director of pain medicine at Mass General Hospital, Harvard's flagship hospital in Boston. It doesn't stop there. Dr. Fishman has been an instrumental thought leader and luminary in the field and been an advisor to the Attorney General's office, to the DEA, to the CDC, to the National Institutes of Health, to our governor's office in the Assembly, and to many more. At the International Association for the Study of Pain and as an international leader, Dr. Fishman has led the charge in understanding education and the gap that we have in allopathic Western medicine and understanding pain and how that has implications to health. But this particular talk is unique and interesting because as we focused on illness, we're understanding how to be better, how to be well. And what better individual that has accomplished so much in looking at understanding pain throughout different aspects of an individual's life, even end of life, to describe how we reimagine healthcare. So I am very excited to introduce Dr. Fishman in his description and lecture on pain and wellness. Thank you very much. Thanks, Scott. Take it away.
Thank you, David. Can you hear okay?
Yes, we can.
Yeah, great. Well, it's a real privilege to be able to give this talk on a subject matter that is near and dear to me, and actually I can say it's near and dear to David Copenhaver as well, who was gracious enough to grab the baton from me as the second chief of pain medicine at UC Davis, and I can't imagine a better colleague and a better leader. Dave recognized early on that so much of what we see in pain medicine is due to deconditioning that could have been avoided through lifestyle changes. And we've been talking about this issue of pain and wellness for well over a decade. And what has happened is through this journey in pain medicine, we've come to see very clearly this wellness gap that we have in healthcare, and the two are quite tied together. So I want to give you an overview of this subject, but I need to make a caveat that we could spend a couple hours each week, probably for a year, covering this topic. This will be a pretty high-level overview, and many of you who registered sent in questions already, and most of those questions have to do with pain issues, and we're probably not going to be able to answer those today, nor will I probably be able to drill down really specifically into some of the granular issues that you may be you may be interested in. But we will try to take as much time as we can to field questions. So feel free to put those forward in the Q&A session. I want to fully disclose, I have no financial relationships with any companies. I don't get paid by anyone other than UC Davis and for the royalties for books that I've written. And I have a long history of working with a lot of different organizations, like David said, such as professional organizations, and some state regulatory organizations. But I want to shift this really back to the beginning of why we have pain and how pain was thought of early on. Some of you may have seen this picture before of a young person touching their toe with fire, and this idea that an alarm goes off. And it's true that pain is definitely an alarm. It's an alarm system that is architecturally designed to tell you that there's potential harm or healing, and it's absolutely necessary for sustaining life and restoring health. In fact, people who are born without the ability to feel pain, it might seem like a nice idea, but they actually injure themselves all the time and die young. So pain is really a vital system within our bodies that help us adapt and stay safe. I'm always surprised that I have to talk about why we treat pain. It would seem self-evident that ethically we have a responsibility to cure when we can, but treat suffering always. And pain management fits right under that umbrella. So that's the work that we do in the Pain Center and the Division of Pain Medicine and the Center for Advancing Pain Relief. And it goes back to thinking that was a long time ago, back to the days of Aristotle and Hippocrates, when they thought that pain was not a sensation, but was an emotion. That Aristotle had five senses: sight, hearing, touch, smell, and taste. And Hippocrates felt like pain was due to an imbalance of vital fluids. Now, many may scoff at this, but I would argue that they may have been more correct then than many of us are now about pain. And in the 1600s, Rene Descartes, or the author of the Cartesian model of medicine, which was really a reductionist model that separated out the mind and the body. And he felt that pain was just a rope on a bell, and that when the alarm was triggered, it would ring the bell, or it would ring the iPhone, and get your attention. And this fell on the heels of a major discovery in medicine, which was the circulation of the blood. The idea that there was this system that had just been discovered, that blood circulated, and it stimulated this intense desire to try to reduce down all of the systems in the human body into bite sizes. And that was really great for a circulatory system, but the pain alarm didn't fit that. And if you actually look now at how pain has evolved, you can see that pain actually in the early 1900s was viewed as simply a symptom, simply an indicator of disease, but really not worthy of consideration on its own, a distraction for clinicians, and really unworthy of serious focus. Now, going back to Aristotle and Hippocrates, in the 1980s, we started to realize there was a renaissance and a recognition that pain wasn't just an important system, but it was an integrated system, a system that not only tells us about survival, but also is a system that can be harmed like any other organ. And when the alarm system becomes diseased, it becomes a source of torture. So that's when pain is transformed from a symptom to a disease, and something that was really recognized in the 1980s. Now, if you kind of come back to today, I'm not sure we've come all that far. We've kind of been on a pendulum or a seesaw in terms of our views, because the World Health Organization has identified undertreated pain as the #1 health problem in the United States. About 1 out of 5 adults suffering from chronic pain, exceeding diabetes, heart disease, and cancer combined, at an enormous cost in dollars, $635 billion as of 2008, thought to be closer to $1 trillion today. But the cost and suffering is really immeasurable. And the point I want to drive home to you tonight is that chronic pain worsens all dimensions of health. And this is really a stunning statement, but one that anyone in chronic pain should understand, and anyone who loves someone, who knows someone in chronic pain, should take heed to. Chronic pain has long-term causes and consequences that are biological, psychological, and social. And in many ways, that's why I sought out the training that I did, that David mentioned to you, that I trained in really the mind and the body. I trained in internal medicine as well as psychiatry, but also did work in specialty work in pain management through anesthesia, and palliative care also through anesthesia, internal medicine, and psychiatry. So these are really mind-body fields. And when you look at people who have chronic pain, there are a lot of factors associated with the disorders that we can't do anything about. We can't change the age, sex, cultural background, socioeconomics, the injuries, or the genetics in most cases. But there are many modifiable associations with chronic pain that are completely in our control. We can't always control mental health, but there's much that we can do to modify it and to prevent mental illness. Physical activity, sleep, diet, obesity, all outcomes that can be modified by lifestyle. Multiple chronic illnesses affect chronic pain. They make it worse, and chronic pain makes those disorders worse. Many of those are preventable or modifiable through lifestyle, and the same is true from with employment and occupational status. So let's look at these modifiable factors. But first, I can tell you that the International Association for the Study of Pain, which is the leading professional organization in the world, #1, defines pain not as a sensation, but actually as an emotion. So we're brought back to BC times in terms of our understanding, and you have to ask how is that possible that we've come this far and we're going back to those kinds of thoughts, although they understood something that we're just coming to understand now. The IASP suggests that we can prevent chronic pain through maintaining a healthy lifestyle, through diet and weight control, exercise, eliminating unhealthy practices such as excessive alcohol use and smoking, work and rest in a variety of healthy postures or movement, managing stress, participating in enjoyable activities, and reducing sources of unnecessary stress whenever possible. Mental health is a major factor in chronic pain. It doesn't cause chronic pain, but it makes chronic pain worse, and chronic pain makes mental illness worse. Anxiety and depression are widely associated with chronic pain and worsen the prognosis of those conditions. And again, these are interchangeable, that chronic pain will diminish mental health, and mental illness will worsen chronic pain and limit the ability for people who have pain in any form to be able to cope with it. This is actually data from our colleague Fadil Zaidan at the University of California, San Diego. He did this work back east, and I'm not going to go into detail just because I don't have time, but what he found was that through very, very high-tech functional MRI imaging of the brain, actually looking at the brain in action, he was able to show that mindful meditation itself actually could change the way the brain handle pain and make it more tolerable and something that one could either cope with or distract from. Many of you may have heard of the name John Kabat-Zinn. He is really the founder of a movement called mindful meditation. He is a psychologist from the University of Massachusetts, where I went to medical school. And when I was a medical student, this young, brash psychologist came to talk to us about the work that he was doing in the basement with chronic pain patients who no one else could help. And he was helping them to deal with their chronic pain, and in many cases reduce their chronic pain through meditation. So I want to share with you, that was John Kabat-Zinn. I think I may have been the only one who went down to see what he was doing, because I think people just didn't believe him. But I have a little video here. I'm going to stop sharing here for a moment and now go back to see if I can get this for you. I'm hoping that you all can see this now. And I want to play this quick video for you. This is John Kabat-Zinn.
Well, nobody wants to fall into a condition where, you know, you wake up in the morning and your body's hurting, or you can't even sleep at night because your body's hurting. And some chronic pain conditions really are like that. And people who suffer from chronic low back pain or chronic headaches or, you know, facial pain or whatever it is, there's so many different conditions that have pain associated with them. And then you discover what the limits of medicine are, because you go to the hospital and hoping that they'll have some special pill, or, you know, in the worst case scenario, some kind of magical surgery, and that it will just make your pain go away. And then, you know, you basically come to a rude awakening, times where you discover there are real limits to medicine, and sometimes the drugs that you would take to alleviate the pain do other things to you that you just don't want to do on a long-term basis. So we see people, again, who have long-term chronic pain diagnoses and conditions, and we invite them to actually turn towards their pain, tune in to the sensations, and to stop using the word pain altogether, and or be aware of how much you're using the word pain, and instead substitute like discomfort, and then zero in. Just drill down into what you mean when you're talking about pain, and say, well, like, what is it in the body? What kind of sensations are they? Are they rending? Are they pulling? Are they crushing? Are they, and there are all sorts of descriptors that actually help us to get a sense of what's called the nociceptive dimension of pain, how it is in the body, the somatic element of it. Then there's all the thoughts about the pain, like this is killing me, it's going to ruin the rest of my life. That's not pain. Those are thoughts, but they're contributing to the suffering. So we can make a differentiation between the bare sensations and the total suffering package that, to a large extent, we're generating ourselves through our thoughts and our, you know, reactive emotions around it. Once you cultivate mindfulness, you learn to uncouple the somatic sensations from all the thoughts and emotions. And that actually, you still have the sensations, they can still be unpleasant, but the knowing of unpleasant sensations is actually liberated from the suffering. And it's just the way things are. And the more you befriend the way things are in your body, the more people find that, you know what, I'm learning how to live with this. Do I want it? No. But is it eroding the quality of my life? Not the way it was before. So you can practice this by just like getting your toe in the water. You know, it's just like take a kind of open look at the discomfort and just feel it, open to it. Just maybe for 15 seconds or one in-breath. Or if one in-breath is too long, try half an in-breath. and then go back to like whatever you're doing to distract yourself or think about or whatever. But then more and more, it's like dip your toe in a little longer, go a little deeper with the foot, and gradually begin to reclaim your body, even the parts of your body that hurt and that you don't want to deal with. And I'm not saying that this is a substitute for medical treatment. This is a profound complement to whatever medical treatments there are. But as I said, in many instances, there are very real limits to the medical treatments for chronic pain conditions at this particular time.
Let's see if I can get us back to our regularly scheduled program here. Houston, we have a problem. All right, here we go. All right, let's see if we can get back now. All right, give me just a moment here. All right, hopefully we are back. And I'm going to ask if you are having trouble seeing this or can't hear, I'm going to ask our other hosts, JR or
Yeah,
Dave.
look, it looks good on our end.
Okay, good.
Yeah, and sounds fine.
Okay, great. Thank you. So we're back on track. John Kabat-Zinn's work is, he really captured this terminology of mindful meditation. Mindfulness is really the intentional application of concentration, the intentional awareness of moments in our lives. Something that actually was really developed thousands of years ago, and now is being understood to not just help pain, but really to help all sorts of aspects of our cognitive lives and our emotions. Something that I think is an essential part of living, because we're all mindful at some level, and many of us don't realize how much control we have over what we attend to in our lives. And that's what this work has really helped thousands and thousands of people to gain control over some of the suffering that they have in their lives, whether it's emotional or pain or other forms of suffering. So I recommend that any of you who are interested in this aspect of really wellness, take a look at some of the information that's out there on mindful meditation or meditation in general. Switching to physical health and exercise, again, I'm not going to go into all of the detail about the benefits of exercise. I think it's self-evident to most people. But what's interesting is we were talking about mental wellness, that exercise is really one of the keys to mental wellness, but it also is a key to physical wellness. It supports our health, our flexibility, our strength, our immunity, etc. And again, I mentioned before that there are all sorts of other modifiable factors associated with chronic pain, like chronic illnesses, diabetes, heart disease, etc. We know that a large proportion of people with chronic pain also have coronary heart disease, pulmonary disease. Most of it is musculoskeletal. It turns out that many people with depression and anxiety actually have very, very common somatic features of even mental illness. Somatic features meaning physical ailments that are perceived as pain. And some people would say, well, that's not real. And I would say that it is real. And I think Aristotle and Hippocrates would agree with me. obesity and pain, a lot, we're a society that is very focused on size and shape, and there's no question that there's a relationship between body mass and chronic pain. It is probably related to not only the weight bearing on our joints, but really the the reduced physical activity and deconditioning in some cases of obesity. And then there is data on weight loss and improved pain outcomes, but weight loss doesn't improve pain outcomes in all people with chronic pain. And physical exercise really helps everyone if done properly. Sometimes physical exercise done improperly can be harmful. So it's not just a one size fits all. And as individuals, we all have to think about how we may approach that. I'd be happy to talk more about that in the Q&A. Sleep is one of the most undeniable factors associated with pain. People in pain have trouble sleeping, and people who have trouble sleeping have increased rates of pain. And again, there's great data here. There's a chicken and the egg, phenomenon here that we're not sure of which came first, and it really doesn't matter. But it's hard to know in people who have both, which is the driver, and it's probably both. You're probably all aware that there are foods out there that are thought to be more healthful than others, some that are thought to be anti-inflammatory or help with nerve health. I mean, I think that there are foods that people talk about helping with one thing or the other. And I'm not going to pitch any of these other than to say that we know that diet can help chronic pain, and the foods you eat can determine how well your body fights painful inflammation. Your diet can help. This is a quote from a professor at Harvard. Your diet can help support your immune system by having it turn on and off at the appropriate times. Yet a poor diet can alter your immune system so it acts abnormally and contributes to persistent low-grade inflammation. There are many different elements that have been identified as potentially helpful with inflammation, like omega-3 fatty acids, flavonoid compounds, vitamin E. There's strong evidence that polyphenols are helpful with inflammation, extremely or associated with substantial anti-cancer effects. But again, we're taking a reductionist view on very few molecules and not considering all the other things that might need to go with them. So I can't tell you that you should change your diet to only blueberries, or make sure that you eat ginger with every meal. But again, I think there are balanced ways to look at this. The ISP, the International Association for the Study of Pain, has made these recommendations. And again, I'm telling you this because they're a reputable organization. And I think there are a lot of other ways to have healthful diets, but they state aim for half your meal to be vegetables and include vegetables as a snack. I think that's exactly what our federal government and the HHS, Department of Health and Human Services, would recommend as well for a diet. And eat good quality fats. Avoid saturated and harmful fats. These include, oily fish, flaxseed oil, and canola oil, linseed, walnut oil to boost omega-3 intake, and reduce and limit ultra-processed foods and sugar intake. I think that's probably common sense to most of you. A healthy diet is something that I think is fairly individualized. And if you look around the world at people who live well, they eat different diets. One of the diets out there is the Mediterranean diet that we'll talk a little bit about. But before we move to that, I just want to talk and end with a little discussion about what happens in pain. I've talked about a bunch of risk factors like fitness, comorbid diseases, sleep, poor diet, emotional issues. I I haven't really mentioned social issues like abuse and injustice, spiritual issues like burnout, loss, um, inadequate purpose in life, um, and then environmental issues that we live in terms of climate change and things like that. And I've talked a little bit about protective features as well. Really the opposite of these risk factors like exercise and movement, good sleep, a healthy diet, joy, happiness, relationships, purpose, direction, passion, optimism, and living in a safe and healthy environment. These are kind of like a yin yang of effects in our lives. And when someone has pain, and that's what this diagram is trying to represent, it's really a cartoon of what happens when pain occurs. If you have a healthy diet or healthy lifestyle, that healthy lifestyle will decrease your risk of pain transitioning to something that's chronic. It will also protect you from pain undermining your function and impairing your ability to go on with a happy, productive life. If you're not well and your body is vulnerable, not working properly, you're more likely for the pain alarm to go off because that's what it's meant to do. It's meant to tell you that you're at risk. So the less well you are, the more likely that alarm is going to trigger. And I often think about, not everyone who has these risk factors gets chronic pain. But, I like to think of a car that isn't moving is far less likely to get into an accident. It's not impossible. And it does happen, but it's very, very unlikely. And once the pain system is generated, it's an alarm that actually stimulates the fight or flight response, and it puts our bodies at risk. And unless we're in a healthy state to modulate that alarm and make it turn off when the risk is gone, when the potential harm or healing, when the potential harm is gone and healing has occurred, we're increasingly at risk for that pain to transition to chronic pain, and that chronic pain to then feed into a cycle of poor health. So I know that's complicated, and I'm happy to talk about more of that. But now I want to transition really more to now the wellness model and go back over these issues from a wellness lens. Wellness is probably the worst word ever because it's something that everyone agrees on and no one can really agree on what it is. Almost everyone is for it, and most people don't follow through on what they even know will help them to have a healthier, higher quality, and longer life. So this is a survey that was done by the World Health Organization where they simply asked people, do you believe being physically active is important and beneficial? And 9 out of 10 respondents said yes. And then when they were asked, are you currently physically active? Only 2 out of 10 said yes. I want to stress that there are a lot of ways to be healthy and active. It's not just physically active, it's mentally active, it's spiritually active. There are many features to being healthy and being well. We like to think about it as what you put in your body, what you do with your body, what you put in your mind, and what you do with your mind. But these very simple concepts are affected by all sorts of things in our world, not just our food and not just our illnesses. It's our environment, it's finances, it's social, it's spiritual, it's intellectual, etc. And if you take the inverse of wellness and look at illness, we're probably the least well society I know of. We spend more on healthcare and we have some of the world's poorest outcomes. we have the highest the worst mortality data of any first world country in the world. And these were declining even prior to COVID, and they're clearly tied to chronic diseases that are mostly preventable illnesses with attention to lifestyle. The CDC in 2022 said 72% of adults were overweight or obese. Almost 20% of our children were obese. Almost 10% of adults had type 2 diabetes. And this is really staggering to me. If you look at people over 65, almost 50% of Americans are pre-diabetic, meaning that they're walking on at that tipping point of becoming diabetic, a tipping point that can be completely controlled with lifestyle changes. 60% of 2-year-olds in the US are on course to become obese by age 35. So what's causing this? Well, I would say, at least in part, is due to a very low priority for wellness in the American healthcare system. You probably know that wellness is not something that your health insurance pays much for. And in fact, just yesterday, a judge in Texas ruled that federal insurance, the so-called Obamacare provisions that would pay for preventive health care, are unconstitutional and should be removed from these insurance plans. I would say that this idea of wellness is something that is very American, in the sense that we think of it as a libertarian right to live the way that we want to live, but also a responsibility of each of us to take care of ourselves. Even though there are very few consequences as a society, there are certainly consequences to us as individuals. Unfortunately, our health system takes the exact opposite view, that it's not their responsibility. If you look at health systems throughout the country, pretty much every health system has a wellness program, but they're largely focused, almost completely focused on the wellness of their employees or the students in their schools, so that the employees are healthy enough to come to work and the students can graduate from the schools. But if you look at actually how we train our students, and you recognize that while we're health systems and we don't in any way participate in wellness, we're really not health systems as much as disease response systems. And as such, we train our clinicians to be disease responders. On top of that, if any of you have ever tried to look into finding really reliable information about wellness, there's not a lot of it out there without finding someone who's trying to sell you something, or has has an axe to grind, or a product to sell. There's not a lot of reliable information, largely because, again, society has not taken this on as a priority. So where do you go with all this? I would say that you first have to recognize the problems, and problems that actually have pretty easy solutions if we're willing to make changes. Just look at sedentary behavior and think about, for each of us should think about how much we sit in a day, or how much movement do we do. I'm always reminded of, growing up in a family where it was always a competition to see how close a parking space we could get to where we were going, as if having to walk across the parking lot was a failure. And we see that sedentary behavior is truly a risk for all causes of disease. But look at the benefits of physical exercise, that it lowers the risk of all causes of diseases, cardiovascular diseases, diabetes, lipid diseases. It improves cognition and reduces dementia, including Alzheimer's disease, lowers the risk of common cancers, improves quality of life across the board. It increases your chances of living longer. I like to tell my patients that they're likely to live longer, and my job is to help them to be happy about that. It reduces anxiety and depression. It improves sleep. It will lead to weight loss at some point. It improves our bones and our muscle strength. It improves our physical functionality. It lowers our risk for falls and fall-related injuries as we get older. This is a study that was just released last year and got a lot of play in the media, that they found that there's a hormone that is released from muscles with exercise that actually protects us from Alzheimer's disease. So how much physical therapy or how much physical exercise do you need? Well, again, it's the Department of Health and Human Services in the United States has kind of put out guidelines for the average person, but again, it's for the average person. Not everyone can do it, and it's probably not enough for some people. Moderate to intense aerobic activity should be about 150 minutes a week. That's 20 minutes a day or 30 minutes 5 days a week. And 2 days a week, you should do some activity that will help strengthen muscles. And that's resistance activity. So again, about 20 minutes a day of getting your heart rate up, and 2 times a day doing some resistance exercise. That's not a lot. And for many people, they would do much more than this. Others, or probably the average American, does less based on pretty good data. Now the question is, what should I eat? If our refrigerators had cameras, this is what it would look like for some of us. There are a lot of diets out there, and again, there's a study that just came out. Well, there's very good data that certain foods can help with dementia, and certain diets can help with dementia. This study on the right was reported on the 11th by CNN, but it actually came out in the literature on the 8th of March, just last month, about a month ago, showing that the Mediterranean diet was effective in reducing pathology seen from Alzheimer's. Now, the Mediterranean diet is a diet that includes some meat. It's a high on vegetable diet, and it actually includes some alcohol. So, you may hear that plant-based diets are the way to go. And I think there's very, very good data that plant-based diets are possibly the best diet we could have, but others would argue that it's not. And while you'll see that the Mediterranean diet here was lauded in the media as the diet to follow for Alzheimer's, it really isn't. It's just one good diet. And good diets probably will help our brains more than bad diets. And that's what I think we can take from this. So what's a good diet? Well, there are many. There are diets that are filled with whole foods, very low in processed foods for now. Processed foods aren't necessarily bad for us. The problem is that processed foods in the United States are really made more for economic purposes than health purposes. They're made to make food appealing and easy, but unfortunately they make it too easy for the body to digest and almost act like rocket fuel for the body, and overwhelm systems that actually are evolutionarily designed to deal with foods that one would find in gathering them, because it's only been 100 to 200 years of evolution where we've had processed foods. And that's not enough time for our biology to change. So the foods that I think you'll find that are recommended as healthy foods are ones that are naturally found in the world. And that's not all of them. There are toxic foods that are natural as well. So again, you have to use common sense. The bottom line is that we probably should eat more plants than meats, and that meat should be probably somewhere around 25% or less of our diet, and plants should be more like 50 to 75% of our diets, with actually digestible greens being about 50% of the diet. So I actually like the Michael Pollan rule. Michael Pollan wrote a book called The Omnivore's Dilemma, Food Rules, and others. And what he said, he's a journalist actually, and he's a professor of journalism at Berkeley, and has researched what to eat probably more than anyone I know of who's not a scientist. And what he came up with is eat food. Food means none of the ingredients would be unknown to your grandparents or your grandparents' grandparents. And don't eat too much, and eat mostly plants. So I think that that's reasonable advice. So with that, there are many things that we can do, and it's not just the things that are obvious in terms of exercise and weight and diet and weight, but really these changes can affect our genes, and there are studies that show that eating a healthy eating a healthy diet can actually change the appearance and what we call the morphology or the structure of our genes, which are absolutely necessary for health and for us to continue to grow and our bodies to heal itself. So this is really profound findings that if we manage our lifestyle, if we manage our movement of what we put in our bodies, our food, what we do with our minds and our mental stress, that we can actually change our physiology. Again, I could show you all this data, but we definitely don't have time for that. I'm going to just, this will be the last study that I show you, which is there's data on dancing in terms of a physical modality. Dancing has been shown to be an effective intervention for health. And in fact, it's probably a better exercise than many other exercises that it's been compared against, because it does something that many of the exercises we do to compensate for not exercising are missing, which is it's not only physical movement, but it's balance, it's coordination, it's focus, and it's social it's social connectivity, which I can't emphasize enough. So, this is actually a study that showed that dancing actually can help people with dementia. And dancing is not something that you have to do to be healthy, but it just gives you a sense of what you might be able to do. There are many, many alternatives, but that it's not just moving, and it's not just eating right, and it's not just meditating all the time or managing your stress, but it's a variety of different issues that address how we live well. And honestly, I can tell you that we don't have enough science to tell you exactly what to do, but we do have observations of people who have lived happy, long lives in the world. And these are called blue zones. These blue zones were found by a reporter for National Geographic, and there are parts of the world where people live longer, live healthier, and happier lives. And they're found throughout the world. They're on an island, the island of Sardinia in Italy, an Aegean island in Greece, Icaria, a peninsula in Costa Rica, Okinawa, Japan, and Loma Linda, California, in the Inland Empire of all places. And again, I don't have time to go into detail about what each one of these communities do, but the point I would make to you is none of them do the same things. But what they found is that there were 9 traits of each one of these groups that I think you can take to the bank in terms of guiding what you might want to do if you're going to change your lifestyle to avoid pain, but just in general, also just to improve your quality of life and probably your quantity of life. And that is, they found that in all of these groups, these communities didn't have to find artificial ways to move. They moved naturally in their lives. They walked to work. Movement was a daily expected activity. not a scheduled event. Their lives were purposeful. They downshifted, meaning that they didn't avoid stress, but they were able to manage stress and turn off the noise. They followed an 80% rule for their diets, which is they stopped eating when they were 80% full, and they had a plant slant, meaning that they largely ate a plant-based diet, but not completely. And I don't know if any of these communities are completely plant-based. And here's another one that's controversial, that many of these communities, not all, consumed alcohol. But unlike Americans who, you can go to any bar in America any night and find people who are drinking to dissociate them from their lives. And that's probably in many ways a driver for much drug use and abuse in America. This drive to dissociate. These communities were driven to associate, and alcohol was used in that purpose. It was used very moderately and used for social connectivity. On top of that, one of the features of these communities were people belonged. They had roles in their community, and they were connected to people widely beyond their families, but they also had a loved one first mentality, that the nucleus of their community was family. And then this idea of a right tribe is that they lived in communities that supported their healthy lifestyles. So these are really, again, there's not one way to do any of these, and yet they're, I think, guiding principles that we can all follow in life. And I think the very optimistic part of it is that these are areas of life we all have, and that we all can look at and probably modify a little bit and start with. So my final thoughts here to you tonight is that pain and wellness are connected. That pain undermines our ability to cope with life and makes us unwell. Wellness helps us cope with pain when it occurs, and the two have an interplay that can be either beneficial or harmful. So I think my take-home message to you is, if you want to avoid pain, stay well. David Copenhaver has a great saying, which is prevention is the best pain management. But even if you have pain, a healthy body is designed to tolerate it, cope with it, and get over it. And an injured body that's vulnerable is prone to pain, having an intensified alarm, and undermining our mental, physical, and spiritual well-being. On the other hand, if you're mentally, physically, and spiritually strong, you will be fortified if pain does find you. With that, all I can say is that the one thing we can guarantee in life is change. We change as we're aging. We can't use just one way of living because it worked for us at one time. As we grow older, we've got to think about how we live our lives. And what I suggest is that people think about one change you can make over a period of time, and make it, and see if your life is any better. It's not hard to find where you're doing well and where you aren't. And you don't have to start by running a marathon or swimming in an ice lake. We can make very small changes. It's, for most of us, it's a marathon. And even for those of us who are older, you can make changes tomorrow that would impact your well-being for the duration of your life. So my final thought for you today is, make change and start where you are. Most of us would have liked to have started earlier, but we are where we are. The good news is we can impact our quality of life and probably our quantity of life almost instantaneously. So with that, I thank you for allowing me to give you this presentation. I hope you'll think about eating well, moving more, managing your stress, and loving more. And with that, I am going to say thank you. And I think we're going to open up to Q&A, and I'll stop sharing my screen here.
That was fantastic, Scott. Thank you very much. There's in kind of having this introspective view, we have some questions, and we'll start with and certainly I can help complement if there's any additions that you may want. The first question is, have you seen children suffering physical ailments due to trauma or being bullied at school? And we can kind of unpack that, but it's an interesting question.
Well, there's again, this is a topic we could do a whole talk on. Trauma is is really something we all experience at some level, but when it's dramatic trauma, when it occurs dramatically to children, it can have serious consequences on physical and mental illness. Bullying is now well established to potentially cause dramatic harm to children and to adults. Now, on the other hand, there are people who are bullied and don't have post-traumatic consequences. So, it's hard to have a life that doesn't have trauma in it. It's impossible to have a life without stress. So really the question is, how do we help our children to be more resilient to trauma that might occur, and less vulnerable to it? And this is an area of awakening, I think, for our society, and it's an area where actually mindful meditation is now growing, where we're finding that children really need the same skills that adults have, and they're actually probably more open-minded to it than we are. And then on the other hand, children are increasingly inactive. They live in worlds where where they look for virtual reality as opposed to reality, or video games are a part of their activities, rather than being outside moving, etc. And their diets are not particularly good. So there are a lot of ways to make ourselves resilient, but to answer that in a simple way, yes, trauma can be incredibly malignant to children if it's not recognized and dealt with. And really serious trauma can become a lifelong scar.
Thanks, Scott. There's maybe along the same line, you might, and it's a very similar, but has socio-cultural aspects. Can you speak about generational trauma, the experience of recognized trauma from racism, trauma from that perspective, and that dovetails to some degree on how trauma affects the psyche, and then lots of layers to socioeconomics and other concerns that have implications for disability and health. But maybe you might mention a few words on that.
Well, I'll just back up a little bit. I mean, I'm not an expert on this, and there are many, and I would strongly recommend some of the information out there on generational trauma. But this is real, and what I would say is that we think about wellness as what we eat or how we move or how we think, but wellness also has to do with the environment we live in, the air we breathe, the water we drink, but also the situation of economic fairness, justice in the world, etc. And David, that question really goes to the heart of we all live in different worlds that some are more fair than others, and people are really traumatized by the social situations they're in, the inequality that we live under in our society. So Again, I can't go into much more detail than that, but these are real strong factors that affect our, I would say, the balance between illness and wellness for an individual.
Yeah, no, I agree. And I think you would add, I mean, it's, the understanding that we've had in the last maybe decade of adverse childhood experiences, how they portend to have implications on disability and health subsequent to that said disability speaks to both. And in terms of trauma and racism, we've had many discussions at UC Davis that are very profound, and some of them have been dealing even with those displaced from our own concerns on domestically to immigrants and other folks from Afghanistan that have come, that we treat them as patients, for example, here at UC Davis, and we've understood how profound those considerations can be when we look at them. So certainly have implications. Changing gears to understanding mindfulness, is praying, is that similar to mindfulness?
That's a great question. Mindfulness is really simply the intentional awareness that you give to the moment. It's really all that it is, and it seems so simple, and yet it's something that is, it's like holding water in your hands. And we're all living these fast-paced lives that are in the future, in the past. We're always thinking, and I continue to fall into that false concept of I can multitask, whereas really all I'm doing is decreasing the bandwidth for each of the things I'm trying to do, and I'm doing each one more poorly. So I would say that praying can certainly be mindfulness or meditation. And again, I think you can take these principles and apply them to your life. Mindfulness doesn't actually have to be meditation. It can be just a focus on the moment. So Dave and I know very well, we work in operating rooms, and at the beginning of any operation that we do, we actually stop and pause for a mindful moment. And we ask ourselves, why are we here? Who are we working on? What are we planning to do? Are we doing the right thing to the right person, etc.? It's a mindful moment. So not a prayer, but a mindful moment. I could say that a prayer could be just as much as a mindful moment, and every bit as profound or more profound.
Options for those individuals who may be not as mobile. This particular question talks about in terms of exercise. Maybe you could mention types of patients that have mobility problems that can't walk. And then the commentary or do exercise. And I would contend maybe that there is methods that we can consider. Maybe you could unpack that a little bit.
Well, I think that's a great question because it drives us to an extreme. But I would say we're all on that spectrum, right? Which is, I'm fortunate I can do a lot of exercise, but there are exercises I see people doing out there that I will never be able to do. And that's true with someone on the extreme, which is there are exercises there that you and I might not be able to do. But it's rare to find someone that can't do anything. Now it's possible, but very, very rare that they don't have, the actual systems in the body working that would allow them to do exercise. But even, for people like that, they might be able to do even passive exercise, and people who are brain injured and can't even have had trauma to the brain and actually can't even participate or produce the motor activity you would need to do physical activity. So again, that's a very specialized area, and I think those people would need very specialized help, but I do think help is possible.
Yeah, fantastic. Yeah, and there's always been expansive ways to address, whether it be in aqua therapy, hand bikes for folks that don't have lower extremities, It's fascinating question.
Or even,
Uh,
even eye movement exercises for people who
Yes,
otherwise can't actually move any other part of their body.
fantastic, amazing. Um, Mental health and PTSD and elements like PTSD, can they cause pain?
Well, PTSD definitely causes pain. PTSD, some of you may have heard of the book, The Body Keeps the Score by Bessel van der Kolk. Bessel van der Kolk started his work in trauma by looking at the beta endorphin system. And again, he created a model where these, these molecules in our brain that are basically like the body's own morphines are actually what has gone wrong in trauma, where people actually become desensitized and actually have abnormal sensory processing where some sensations are diminished and others are amplified. So PTSD is not just really one thing, but it's a state in which any pain may be either experienced at a heightened amount, or that there might be a neglect to sensation that actually is needed for adaptation and function. I hope that answers the question. There's a lot more there to unpack.
Absolutely. No, amplifying pain in some ways or other considerations. There was a thought perhaps in that trying to unpack it, that the person asking the question said, I've heard about yoga and paralyzed individuals and they practice the movements in their head and were able to regain some mobility through that exercise and practice. Are there studies to support this, and can this increase in mobility through a mindful kind of movement? Would that be helpful, or maybe unpacking that idea?
So that's a fantastic question and absolutely true. And what you're seeing there is the plasticity of the brain, where we can get, and this is one of the real great potentials for, say, virtual reality, where we can take someone who can't move their body, but you use virtual reality to actually see their body moving and create new pathways for it. In pain medicine, we've known for years that we can use something for people who have had an amputation called a mirror box, where we can actually have their brain see the missing limb and move the missing limb and actually help them to decrease pain that they have because of the construct in the brain being stuck in that limb being tangled or in a painful position. They can actually use their mind to create a pathway where that limb becomes untangled and the pain is reduced. So there are absolutely ways to do this. This is extremely well documented in research. And in fact, we now have neuroimaging that shows the brain changing to create these new pathways.
We have a question about acupuncture at UC Davis, and it says, I see a lot of information about acupuncture. Is that considered a type of pain management?
So acupuncture is probably the most time-tested therapy known to mankind. It's probably 5,000 years old. So while we have a lot of science on acupuncture, the science is conflicting. We really don't know how acupuncture works. But in medicine, we think of evidence-based medicine, which is really an aspiration. We don't have evidence for everything that we do. So we have to put together the pieces of evidence that we have and the experiences and the observations that we have. And for acupuncture, we largely have experience and observation that it does work. We can't predict who it works on, but it can be very potent for some people in reducing pain and sustainably so, that it defies this belief that it's somehow a placebo. I hope that makes sense, because placebos are very effective, but they're typically not sustainable. So with that said, we know that acupuncture works for some people. We don't really know the exact mechanism of it, but we've had a lot of experience in the world that acupuncture, a lot of people have received acupuncture and it seems to consistently help. With that said, acupuncture that is done properly is very, very low risk. So when we make a decision in medicine to try a treatment, it's based on the benefits versus the risks. So in acupuncture, we know there are benefits. If you came to me and asked me, would acupuncture help? I would have to say no, but it potentially is worth trying because the risks are so low.
Yeah, that risk benefit equation is key. This one of our audience members asked that, when I flex or stretch my muscles, it seems to reduce my pain. Why is that?
Well, muscles are, muscles, number one, are the largest organ system in the body. They're the major receptacle for our energy in our bodies. And they're very complex organs that can produce pain on their own. And people are really bewildered by muscle pain because, if you're stung by a bee in your back, you know exactly where that bee stung you. But if you have a muscle that hurts, it doesn't have that, what we call somatotopic distribution. It doesn't have a map because evolution hasn't caught up to muscles being something that that are helpful for us to track. So for instance, if you have a heart attack and you injure the muscle of your heart, you may feel that down your arm or in your neck, not at all in your chest. So muscles have this capacity to cause pain, and sometimes they get stuck in a physiological pathway that stretching them or contracting them actually reboots and will stop that cycle and allow them to reset. And I think that's probably what's happening I don't know exactly what's happening with the questioner, but again, we have people who come in with muscle pain, and we will stretch, we'll contract. If you do an isometric contraction, you can actually then release the muscle, and it's at a lower resting state. And then we'll actually do something called trigger points for muscles that we can't release otherwise, where we'll actually break the signal by needling in the muscle or in a trigger point within a muscle.
There's a question, Scott, about long-term chronic pain and the idea that does long-term chronic pain result in a higher tolerance or toleration of pain, or the tolerance of pain?
It's a really good question. People who have chronic pain, it's interesting that if you look at human beings in pain, and you put a heat probe on their skin, with a very finite amount of heat, we all feel pain right around the same temperature, but we're all different in how much we can tolerate. So that, what that is it's the pain threshold and the pain tolerance levels. The pain threshold is very consistent. The pain tolerance is all over the place. So people with chronic pain still have the same pain threshold, but for many, their tolerance for pain has gone up because of the exposure and probably the secondary learned behaviors, the things they've had to learn to cope with pain, that that others haven't had to learn because they're not exposed to pain every day like a person with chronic pain. I hope that makes sense, and that's something that we've clearly seen in the medical literature.
There was a commentary, Scott, about genetic conditions like neurofibromatosis. It's more of a question about will there be more pain related to certain conditions? And that was an example of one. And maybe it won't be explained in this talk, but perhaps in the future, and maybe you might have some insight about certain neuro type conditions like that, genetic conditions.
Well, there are certainly genetic conditions where of the nervous system, and when the nervous system is diseased, again, it's a very integrative system that controls every part of our body, including our sensations. So when the system is diseased, we're vulnerable to all of our sensory systems becoming diseased. So for instance, neuropathic pain is essentially a broken nervous system alarm. And you can look at many nervous system diseases as broken kind of either alarms or thermostats within the body, which is what the nervous system subserves at a really critical biological level. So it's not surprising that people who have a genetic predisposition have this not only affecting them throughout their lives, but while they're developing. And so that, as they're, these genetic conditions that occur during our developmental years affect us in a more amplified way.
Now, this is a bigger question because it's a very simple one, but it's complex. How to deal with nerve pain, and then followed by spinal cord stimulation or neurostim implants, and discuss maybe how they work or how they can be helpful for that.
Well, nerve pain can be a lot of things, but chronic nerve pain is usually due to an injured nervous system. So that's really a great example of when the symptom of pain becomes a disease, where the nervous system that actually sends the alarm message is the problem itself. And at that point, we treat it by trying to diminish the injury to the nervous system, which, to put it as simply as I can, the nervous system becomes over responsive. It becomes automatic in its reactivity to any stimuli. So that's why, say, someone with diabetic neuropathy or neuropathic pain would tell you that even a light sheet touches their feet, it hurts. That's abnormal. That's abnormal neurological processing. So we treat it by trying to decrease the firing of those nerves. Now, the problem is that when we use drugs to do that, it can be very effective, but the problem is that you can't get the drug just to the damaged nerves. It goes to the whole body. It goes to the entire brain. So people who use those drugs will often tell you that they're a little cloudy. And while they'd rather be cloudy than have the pain, it's a secondary consequence of the treatment that is undesirable. So that's really where neurostimulation comes in, where we've really learned now to use electricity, which is the language of the nerves, to jam the signals. It's kind of like wartime, where you were figuring out where these evildoers are, working their communication, and we get the same electrical signals that are generating those messages to block the message. And it's really based on an important finding in the nervous system, which is the nervous system is a communication system with a bandwidth limit. There's only so much signal you can put in. So if you have pain signals coming through a pathway, you can put in non-painful stimuli and drown out the painful stimuli. So that's a very simplistic way of looking at that. Now, Dave, you're the master of putting in these devices, so I'll turn to you and see if there's anything else you want to add to that.
No, I think, it's one modality to address nerve pain, but you said it best in that it's how our body receives or perceives pain and altering that perception. Which speaks to a whole other component. Is there a connection, one question asked, between the brain and the gut and gut health and pain? And maybe you could unpack that one, which that's a whole probably session on that very interesting dynamic. But
well, I'm probably deficient in this talk by not mentioning the microbiome, but the gut is probably the largest immune organ in the body. And it's important because it's loaded with microorganisms that affect our immunity, and actually in many ways direct how healthy we are. So a healthy diet is probably, there's a lot to a healthy diet, but a lot of it is keeping that gut microbiome, our immune system, really our missile detection system, well fed. And what feeds that system is something we've just come to understand in the last 10 years, which is really fiber. And there's certain foods that support the health of the microbiome that will make us more resistant to illness. And when we get illness, we're more prone to pain. So I would say absolutely there's evidence that there's a connection between gut health and pain. And there's a connection between what we eat and gut health. And there's probably a connection also with our physical activity and our mental stress and gut health as well. So, this is never just simple, and it's all kind of connected. And it may seem like it's overwhelmingly too complicated, but I would just take you back to the end of the talk where we can see people who are living lives where they're happy, healthy, and have longevity. And they, follow all these principles that I think are feeding into these, complex phenomenon, but phenomenon that we don't have to fully understand to reap the benefits of the lifestyle changes.
Yeah, no, it's reminding me of Emran Mayer at our colleague at UCLA, the mini brain and the gut. And it's all of our, we have amazing colleagues, and this work is always expansive. If you could talk a little bit about physical pain and mental illness, can you explain how that physical pain can cause mental illness?
Well, everyone's experienced pain, and if you've ever experienced severe pain, that, when you're having severe pain, you're probably not tweeting, and you're not doing your hobbies, and you're not really all that happy with your life, because the signal is designed to grab your attention and make it so that all you can do is answer that call. Okay, that many of us can avoid pain, but very few won't respond to that severe pain registry in our bodies that tell us that we're at risk. And when that happens, it makes it impossible to do other things. And when you can't do those other things persistently, it becomes impossible to have quality of life. And our lives get smaller, and they start to break down, and we become isolated. We get, depression is understandable in that setting. I would be very anxious if I couldn't lead the life I want to lead and have the relationships I want to have, and be able to take care of myself and not know what's coming down the road. You feel very vulnerable. And then, really, you become deconditioned physically and emotionally. And that's how it happens. And it's not just mental illness, but it's also physical illness that befalls chronic pain.
Maybe someone who's living with chronic pain has done everything, but can they live without prescriptions? And I imagine it's medications.
Yeah. Again, you don't have to vilify medication to promote wellness, and you don't have to assume that you'll never be well if you take medications. The two can go together very, very well. In fact, I would say that the problem with medications is that we lean on them too hard to do too much for us, and we, the healthier you are, the more medications might have a neater, tighter fit in your life, or you might be able to avoid them. But there are people who need them, and in those cases, they should find the lowest effective doses of the most appropriate interventions, that being medications in some cases, that have the most benefits and the least risks. So some people, a lot of people need medications, but it's not mutually exclusive with lifestyle changes. In fact, there might be a beautiful interplay in that you'll find that your medications work better the healthier you are. Oh, JR is back.
Well, we certainly have time for maybe one more question if we have one. Otherwise, I was going to say we're running up against time, and I wanted to thank you both. I think we probably got all of the questions that were typed in. And so I want to thank everyone for joining us tonight. And I want to thank Dr. Fishman for spending so much time to share so much on pain and wellness, and for Dr. Copenhaver for being here to help with the question and answer portion. As we said at the beginning, this was the third of our Pain Matters lecture series, which wraps up our series for this year. We will be soliciting some feedback from everyone to see sort of what they enjoyed and what topics they'd like. I know that was some of the questions that came up, if we could get some additional information on certain things. So we'll help some of that to or use some of that to help us sort of dictate what topics we might want to cover in the future. But we're so grateful everyone joined us tonight. And again, a big thank you to our doctors, Dr. Copenhaver and Dr. Fishman. And I want to wish everyone a good evening.